Hi, my name is Michael Benfield. This is my assessment of the musculoskeletal system. This is for Albany State University BSN program. So the first thing I want to do when I'm assessing the musculoskeletal system is I want to start with the head. We are going to inspect her jaw. So I'm inspecting for any swelling, crepitus, any tenderness. I'll have her open her jaw, close her jaw back, and I'm looking for glide, range of motion. I want to have her move her jaw, her bottom jaw primarily from side to side, so I'll instruct her to move it one side, the other side, noting any pain or any tenderness, any crepitus. After I have assessed her jaw, I want to move to her cervical spine. I'm going to start by inspecting for alignment of the cervical spine, and after I've done that, I'm going to palpate, and we're going to test for range of motion. So first thing I want to do is have her touch her chin to her chest. Move it back to the middle, back to her neck, back to medium, and then we're going to go side to side. So I'll have her turn her head to the left to begin with, have her turn her head to the right, and when I'm doing this, I'm also noting for any pain, any crepitus, any sounds, any asymmetry. And the next thing we'll do is we're going to instruct her to put her ear on her shoulder, and we'll start with the right side, ear, shoulder, left side, ear, shoulder. Okay, back to medium, and everything appears to be normal there. So the last thing I'm going to do before I move beyond the cervical spine is I'm going to take my hand and I'm going to put it against the side of her face, and I'll instruct her to push away from that. So we'll start on the left side, push away. All right. Same thing on this side, push away. All right. Next thing we're going to do is we're going to start with the upper extremities at the shoulders. I'm going to look at the shoulders, and I am looking for symmetry between the two shoulders. I'm also going to palpate, and we want to note any crepitus, any masses, any pain upon palpation. Okay, and then what we're going to do is we're going to perform the range of motion test. So we'll start by having our instructor put her hands down by her sides, and we want to move her hands behind her back and have her arms at a 90-degree angle. And when she's doing that, we're also looking for symmetry of the shoulder blades, the shoulders themselves, any pain, tenderness that she may have, any inability to get her arms in this degree or tenderness with that. So we're going to move them back down to her side. Next thing we're going to do is we're going to have her take both arms, and I want to extend her arms above her head. Okay, palms together. And I'm noting symmetry, pain, tenderness. Next thing we're going to do is we're going to bring her arms back down by her sides. Okay, and what I want to test for is abduction and adduction. And so I'll have her take one arm at a time. We'll start with the right, and we'll go in towards your body, out away from her body. Okay, back to your side. Same thing on the other side, in towards, out towards the other side, back to your side. Okay. After that, what we want to do is we want to move on to her elbows. And so I'm testing range of motion in this arm itself. So I'll start by holding right behind her elbow, and I want her to bring it up, back down. Again, we're noting for symmetry between the two arms. We're also noting for any tenderness, any swelling, any crepitus within the joints. Same thing on this other side. And I have her bring her arm up all the way up, all the way back down. No tenderness, no swelling noted there. Moving on down her upper extremities, we're moving on to her wrist and her hands. We'll start with her wrist. And so we would examine the wrist for symmetry, any swelling, joint pain. And then what we're going to do is we're going to have her point her wrist all the way down, puts them down, back up. We're looking for range of motion, pain, tenderness. Moving on to her fingers, and we want to do the same thing with those. We want her to close and make a fist all the way out, fingers spread apart. Okay, so we want to lastly check for pronation, supination. We'll go up, back down again. Okay, and no tenderness noticed with that. Last two things we're going to do is we're going to do the Fallon test, and so I'll instruct her to take her arms. We'll put the back of her palms together at a 90-degree angle. Typically, we would hold this there for about 60 seconds. At the closing of the upper extremities, we'll check for tensile sign. So I'll have her take her wrist, extend it out, And what we're doing is we're tapping on the median nerve here, and we're looking for no response with this. So no pain or no response with this would be considered normal. All right. Next thing we're going to do is we're going to move on to the lower extremities, and I'll have her sit down in this chair back here. Normally when you would do this, you'd have the patient laying out supine, but we're going to work with what we have. So she's going to be sitting down. I'm going to examine her lower legs, and we're looking for distribution of hair. I'm looking for any varicose veins, any swellings, any masses, any pain, any tenderness. I want to first check her pulses, so we'll start with the popliteal, or we'll start with the popliteal pulse, checking that. And what we're doing is we're going to check one side first all the way down, and then I'll go to the other one. So popliteal pulse, and it's present. I'll move to the posterior tibial pulse. Next thing I'll do is the dorsalis pedis pulse. Okay, and then I'm checking for the pretibial edema. I'm also checking for temp, and I'll have her spread her toes apart, and I'm checking for any lesions that I might see on her toes. Moving on to the next leg, again we're checking the popliteal pulse. We're going to move down to the posterior tibial, dorsalis pedis, and then we're checking for pretibial edema. Before we move off the leg, we're going to have her again spread her toes apart. I'm checking for any lesions, and I'm also checking for temperature in this leg. The next thing that we would do was we want to check hip abduction and movement and range of motion. So I'll take, and if we were laying down, I would have her bend her knee all the way up, back down. We're noting range of motion, symmetry. Same thing in the other one. No tenderness or pain, and I'd have her do it by herself. And to the left. All right, so back down to the legs again. We're going to go down to the ankles, and we're going to do it on both sides. So we'll start with the left leg, and I'll have her bend her ankle back, forward. Moving on to the toes, same thing. Pull the toes back, push them forward. Okay. Same thing. Back, forward, toes, back, forward. All right. So lastly, what we would do, and this of course would be easier again if she was laying down, but we want to check for cerebellar function. So I'll have her take this right leg right here, and we're going to do her heel down her shin. We're doing it both sides. All right. And that's going to be the conclusion of our musculoskeletal assessment.